Next up on the number one tee.
Well, hello, and welcome back to the Tea Time Podcast. My name is Tori, and today I have Dr. Erin Ellis on. She's a naturopathic doctor who helps women balance hormones, fix crappy periods. I'm currently on one, TMI, and regain energy they once had to be their happiest, healthiest self. And here's the thing. I have wanted to have a hormone specialist on for so long because I think it has a lot to do with performance. And I think when we're out there and we feel a little off, we don't feel in flow, there could be something behind it. So
Absolutely.
Thanks for being here, Erin. Dr. Ellis.
I'm so excited to be here. Thank you so much for having me. I'm glad we could connect on the good old Instagram.
Yes, absolutely. Tracy O'Malley referred me to Dr. Ellis, and I trust 100% of what Tracy says. So I'm so glad you're here. Let's get right into it.
Sure.
And you did come in, you walked in today, and you're like, well, I don't know anything about golf. And that's okay, because we're talking about performance.
Yep.
So it's all athletes. Most of us listening are golfers, but maybe we're pickleballers too, or tennis players. So this would apply to everything.
Or just a gym athlete that likes to work out. Could be applied to anyone.
Love it. So can we first just go through the cycle? The 28 day, is it still considered 28 days? Because mine personally is about 26. But can we go through the cycle and just kind of tell us what is going on with our hormones, our state, our performance during those times?
Yeah, so a normal menstrual cycle is anywhere from 26 to 32 days.
Okay.
Is typically the average cycle. But we want to make sure that your cycle is consistent for you. So you don't want to have a 26 day and then a 42 day and then a 23 day. So if you're anywhere from those 26 to 32 days, that's considered normal. And we have technically, like I like to call it, 4 different phases of the cycle. So the first, day 1 is the day you start bleeding, not spotting. That's technically could be a sign of a hormone imbalance. So day 1 would be, I need a product, Aunt Flo is here, I'm on my period.
Yep. Whoop-de-doo.
Yep. Our favorite time of month. And then you menstruate typically 5 to 7 days. Anything past 7 days is considered abnormal. So I say that first 1 through 7 is technically the menstruation phase. However, day 1 through about day 14 is considered the follicular phase. So we have the menstrual phase in the follicular phase. So during the menstruation phase, it's highly recommended to just chill, really. You don't want to do a golf competition. You don't want to do high intensity workouts. You don't want to do boot camp type things. You really don't want to stress your body out anymore because it's already going through this, process of shedding your endometrial lining. Our hormones are at their lowest, so we want to honor that. What I wanted to point out, I guess I should have said in the beginning, is that by knowing what happens throughout your menstrual cycle, you can use your hormones to work for you and not against you. And like you mentioned in the beginning, it's important to know where you are in your cycle, because if you're out there and you're not performing to your best ability, you could be like, wait, where am I in my menstrual cycle? Oh, Aunt Flo's going to come here in a couple of days. This is probably why I'm not on my game today.
Listen, even though you don't know anything about golf, I'm going to tell you right now, a golfer loves an excuse.
There we go.
Okay, so just add it to the list, ladies.
Blame it on your period.
We have a legit, natural excuse every couple weeks.
Yep.
So when you say we want to take it easy during that time, and again, sometimes these competitions, they are what the timing is what it is. There's nothing you can do about it.
Yep.
But let's say you do have a choice to do that high intensity workout. So let's say you go for it and still do it. Okay. Does that mean you are again depleting your energy? So the rest of the day you're going to be exhausted because your body's already working on overload through the menstrual cycle.
You could. So if you have no choice, oftentimes you can't plan, competitions or meets or whatever in the golf world. What are they called? Matches?
Tournaments.
There we go.
Tournaments, rounds,
You can't plan that around your menstrual cycle.
Yeah.
So sometimes you might be stuck on a day 1 in a tournament. Well, I would highly recommend prioritizing recovery before and after that tournament.
Okay.
So making sure the days leading up to it, you're chill with yourself. You get plenty of rest, you hydrate, you watch your diet, you eat really clean, nourishing foods. And that way you aren't really taxing your body to that extra, degree with that tournament that you have on day one.
You're setting yourself up as much as you possibly can.
Yes. And then afterwards, making sure that, again, you honor yourself, take some rest, baths, prioritize sleep, hydration, same thing, stretch.
Okay, great.
Do gentle things to yourself if it's unavoidable. I mean, it happens to me. I did the 9/11 stair climb on day one of my menstrual cycle.
Wait, okay, what is that?
Well,
so it's in honor of 9/11, but
Yes.
you're going up and down stairs for, I imagine.
So it was right over at Talking Stick, and it was in 108-degree weather.
But where, though? Where's the stairs at Talking Stick?
We went up and down the stadium stairs
Oh,
in Talking Stick Ballpark.
oh, okay.
Talking Stick
Sorry.
Fields.
Okay, sorry. I guess I've never been there.
Like the baseball field.
All right, so how long? Sorry, we're going to divert a second because I've never heard of this. So how many times up and down?
So you do it twice. You go around the stadium twice is considered the same amount of floors as the Twin Towers.
Oh my God!
But the firemen do it. My other half is a firefighter, so they do it in their full gear.
Yeah.
So they have over 100 pounds on, and it's 100. It was the hottest stair climb that I've done to date because we had such an insane summer. But I'm like, I can't not do this. I signed up for it. I'm honoring, those lives that were lost in 9/11. But I'm like, crap, I'm on my period. This is going to suck. But I just took the whole day and I rested. Like I made sure that I honored myself, rested. The next day I was exhausted, but I knew that was going to happen. So I was prepared for it rather than being like, why couldn't I do this?
Yeah.
And beating myself up about it. I knew what was going on and, I didn't have a choice, but I did the best that I could to honor my hormones during that time.
Okay, wait, how long did that take?
It honestly doesn't take very long. It took about an hour.
Oh, okay.
Yeah.
Oh, all right. Well, that's interesting. Okay, so, and you said the menstrual cycle is in the I'm going to say that wrong.
Follicular phase.
Okay, so what happens after your bleeding section?
Yeah, so the
is
follicular
done?
phase is that we're preparing follicles. We're preparing that egg to drop during ovulation, which is in the middle part of the cycle. So the follicular phase, our hormones are building. It's a good time, like as far as work goes, to be creative, to plan things. Like that's where our hormones are best represented is in that first half, like setting ourselves up for success for the second half. Again, in the beginning, you want to be really gentle to your body, but towards ovulation, like day 13, 14, 15, 16, you can start hitting it hard. This is like the best time to go out there and do it because estrogen and testosterone are now starting to climb and they're going to be at their peak right before ovulation because that's like prime time to make a baby for us women. So those hormones are going to be they should be at their highest because we're prepping the egg, the follicle to release and, maybe have implantation if you're trying to get pregnant. But if you're not trying to get pregnant, you can still use those hormones, to your benefit. So a good time to go out and network, a good time to really be at your peak performance as far as an athlete goes, do the HIIT, do the things, train, competitions, whatever the case may be. That's the best time, for it. Right now, I'm approaching ovulation. So I was like, this is the best time in the world to do a podcast because my brain cells are firing. I've got testosterone going. I've got estrogen going. Those are, two primary hormones for women. So it's a good time to ask for a raise or ask a person out or go out on dates. Like this is where you want to be your social self because that's what your hormones want you to do.
Okay, so wait, let's back up. So days 1 through 7, rest,
menstruation.
take it easy, be easy on yourself. Days 7 through 14, start planning, preparing for basically the best couple days that you have.
Well, in my opinion, days 14 through 28 are my favorite.
Okay.
Because you've got like this drive and the stamina to just go. Your hormones are plotting you through that and like cheering you on. And then the last half of the cycle is the luteal phase, which is where progesterone is at its peak. And progesterone is the queen of hormones, my favorite hormone. But this is also the time of month that women dread. And the reason they dread it is because they likely have a hormone imbalance and they don't have progesterone working for them because maybe they're not ovulating So if you don't ovulate, you don't make progesterone. And this is a huge issue in hormones and hormone imbalance. And if you are one that's like hating your life 2 weeks after or 2 weeks before your period starts, we've probably got some estrogen progesterone imbalance going on, specifically progesterone, because progesterone is the queen. Like she is the productivity hormone. This is the last half of the cycle where you want to get crap done. Like again, workouts are still good. You can still, be tough on your body to an extent, but a few days, 5-6 days before ant flow comes, again, we want to slow things down because we're preparing to shed the endometrial lining. It's a huge process. Hormones are starting to tank. So hormones go up and then they go down, and that's when we need to honor them. So technically days 14 through 21, 25 are my favorite days of the cycle because your hormones should be at their peak then.
Yeah. And when you say you probably have an imbalance because you're not ovulating, that means you are going through menopause?
Nope.
What? Oh.
Maybe.
Okay.
Could be anovulation due to PCOS, polycystic ovarian syndrome, maybe a stress response going on, there's primary ovarian insufficiency. There's a lot of different things that can cause anovulation or not ovulating, and menopause, perimenopause, menopause, because the ovaries are the first organ to get tired and sleepy. They're just going to stop producing hormone. So it just depends on, what age you're at and what's going on with the hormones.
Okay, this is going to be a really basic question, but just
You're fine.
listening to you, like, what is the purpose for menopause? Like, why does our body stop producing these hormones? Because the men produce testosterone and no.
So they go through andropause.
Okay, they do?
Oh, yeah. So men actually start declining their hormones 30s, sometimes in their 20s, depending. So 30s, 40s is like when they start, almost the same as women. Like perimenopause starts in our 40s. But if you've had, partial hysterectomy or even a hysterectomy or some surgical things with or oophorectomy and ovary removal or something like that, it puts you at a higher risk for earlier menopause. But it's just, why do we go through it? It's just part of life.
Yeah.
But the important thing is that you don't need to suffer. I have helped so many women recently that have just come to me like, I am losing my mind. I feel crazy. I'm crying at everything. Like they're depressed. They've gained all this weight. They can't sleep. They have all these hot flashes.
Let's stop there. Let's go through like some red flags that maybe if we've noticed this is going on, that's possibly a hormone imbalance. So you kind of just said them. Can we say them again? Like, do you have like a bullet point list that you can go through that is like, okay, you might want to get your hormones checked out?
Number one, you just don't feel like yourself anymore. Point blank. Like you just don't feel like yourself. And so many women go to the doctor and are like, oh, I just don't feel like myself. I'm not sleeping as well. I'm tired all the time. I've put on all this weight. My hair's falling out. I have hot flashes, night sweats. My libido's in the toilet. Like I'm sad. And then one minute I'm happy. And then everyone's like, what's wrong with you? I'm just they feel like they're a hot mess. That's your hormones, but you're not crazy. It's your hormones. And so when we figure out where the imbalances are or what's going on, we can fix it.
Yeah.
And you get your life back. You don't need to suffer.
Okay, let's get into menopause. So how does performance get affected when someone's going through menopause? What can they do? And honestly, when I hear, and maybe I'm just listening to the wrong people or maybe a very small percentage, but when I listen to women that say they're taking hormone, what would it be?
Hormone replacement therapy?
Yes. It doesn't sound that much fun. I don't get a lot of great feedback from it, but maybe that's just, maybe that's not normal. I don't know.
There's a lot of information out there. There's a lot of misinformation out there. So there's good information and there's bad information with menopause. As far as your performance goes, why is it an issue? Well, you're basically like during the menstruation, like when you're menstruating or premenopause, you can pretty much bank on your hormones being pretty consistent throughout the 28 days. They're all over the place. They're different every single day. But in menopause, they're literally like there's no rhyme or reason. It's like someone scribbled on a piece of paper. That's what your hormones are doing. I like to call it a song and dance with your ovaries. 1 minute they're working, the next minute they're not. Then they're not, then they're working, then they're not. That's when we start having irregular cycles, or maybe they're becoming shorter. You'll have like a 23-day cycle and then you have a 45-day cycle. That's normal in menopause because your ovaries are playing that song and dance. They're turning on, they're turning off, they're turning on, they're turning off. And a lot of it is influenced by our lifestyle. So environmental factors, are you getting enough sleep, our diet, stressors, like that plays a role in menopause and in premenopause. So as far as performance goes, it's tough because you will notice, and a good analogy, and this pertains to women, but for men, like they see a huge decline in performance. They see a huge decline in their ability to function like they did maybe 10, 12 years ago. Maybe their endurance isn't where it was, or their strength isn't where it was. And that's because testosterone is their primary hormone and it's tanking in andropause. Their testes are wearing out just like our ovaries are. However, women are powered by more hormones than just testosterone. But that's a good analogy I like to use is the men really see a decline just like the women. But for us, we're kind of all over the place. So it's hard to say like what's going on because 1 minute you might feel good, the next minute you don't feel good. And that's because the ovaries are playing this little song and a dance, and it's frustrating.
Yeah.
But there's a lot of things that you can do during that time to help yourself, whether that's adding in hormones depending on where you are, or supplements to help with these side effects, prioritizing sleep and rest, or getting help with those things because that's affected by the hormones, calming down the hot flashes, which can cause a night sweats and make you not sleep. Like there's tons of things you can do. And you mentioned you haven't heard people feel good. Well, I mean, when I do hormones for my, postmenopause, menopausal women, they feel amazing. It takes a minute to work. Like hormones don't get balanced overnight. Same with, if you're still menstruating and we're working on your hormones, it takes about 3 or 4 months to start seeing some changes, with the hormones. It doesn't happen overnight. And same with menopause. Like typically we'll start seeing a reduction in the hot flashes going from maybe several a day to maybe a few a week to, all right, I'm sleeping longer, but I'm still waking up. All right, well, we're seeing improvements. As long as I see some improvements, we're moving in the right direction, but we're not going to be like fixed back to our, 20-year-old selves overnight with the hormones. And yeah, there's so many different kinds and routes of hormone therapy as well. So it's, finding a practitioner that can explain all of that to you and the risks versus the benefits and how this can pertain to you. I think hormone therapy is so individualized that, it's hard to say like, oh, well, people didn't feel good. Well, I'd be curious why. Like, were they not on the right hormones? Was something else imbalanced? Did they miss something? Like, it's hard to say exactly what was going on with that because I've never had anyone feel worse being on hormones.
Yeah, and that's why I'm like, I think that there was more conversation to be had that day as far as what else was going on. Yep. Okay, so what is that process like as far as testing your levels and then going through the process of, the hormone replacement therapy? Right.
So like we mentioned in the menstrual phase, if you're still menstruating, like it's best to get your hormones tested on cycle day 19, 20, 21. Why? Because that's where progesterone should be at its peak. So it'll give us a good look as to the ovarian function. Because remember, if you ovulate, you make progesterone. If you don't ovulate, you don't make progesterone. You either ovulate or you don't. There's no maybe ovulation. So by testing on that day of your cycle or that range, 19, 20, 21, we can get a good look at progesterone and what its levels or where it's at, and then its relationship with estrogen. So typically progesterone is going to tank first in menopausal women, but we'll still have some estrogen. Once your ovaries are becoming tired, your adrenals take over for a little bit. So it's important to not only test your reproductive hormones, but look at your adrenal function. Look at your thyroid, play a giant role in your hormone cascade there. So there's a lot of things that we want to test to see where you are. Now, if you're not menstruating, or maybe you've had a partial hysterectomy, or you had an ablation, or whatever the case, or maybe you're, menopausal, but you're not, because you have to go 12 full months without a period to consider postmenopause. And then we just draw, and we can kind of get a look at, I look at luteinizing hormone and follicular stimulating hormone, which are ovarian markers, to tell, all right, are the ovaries, sleepy, I like to say, like those levels will start to climb and get high. 2 readings of FSH over 35 for a woman is typically deemed like, all right, we're menopausal. So the ovaries, the chance of pregnancy are pretty slim because your ovaries are hibernating at that point.
Okay, I have a silly question.
No question is silly.
I heard this before. I heard there's a time in your cycle that you look different. No?
So that would be, I would say, your ovulation phase, like you're glowing. That's testosterone.
Okay.
Yep. Most people feel like their skin is good. They're glowing. They have energy. Like they just feel good. And that's usually around ovulation.
Okay. All right.
So no, that's not a silly question.
And how about when when you're having cramps, that is days 0 through 7 then? Or is that leading up?
It could be before. So if you have PMS, just depends on how bad your cramps are. I mean, it's the prostaglandins, which is the pain receptors that can get influenced by hormones, can get influenced by inflammation. Like your cramps should be tolerable. Anything outside of that, if you're taking fistfuls of ibuprofen in the fetal position, calling out of work, wanting to throw up, this is not normal. We've got something going on causing that.
Yeah, absolutely. So what things can help? What are some natural ways that could help balance your hormones? Can just like being out in the sun, low impact exercise, like what things can, like before you go through hormone replacement therapy, what other things can we try to get things to be more balanced?
Stress, diet, environmental. So we'll start with stress. Stress, if we all have stress. Yeah. You have stress, I have stress. I'm running a business. You have a busy active life with golf and podcasting and all that. It's how we manage the stress. So it's making sure we prioritize recovery. It's making sure that we take time for ourselves and that we listen to our bodies. Women are so hard on themselves. And I'm assuming most of your audience are moms, and they put themselves last because they're taking care of their children and their husband. And then it's by the time it's time to take care of them, they're exhausted. So they just go to bed. They get no self-care. So we need to prioritize the self-care so we can manage the stress. High levels of stress can impact our cortisol levels. High cortisol levels, which is our stress hormone, can lead to inflammation. Inflammation can lead to worse imbalancing of hormones or worse PMS symptoms. Diet is huge as far as making sure that we're eating clean, we're eating whole grains, we're eating fruits, we're eating vegetables, we're eliminating the processed foods, the inflammatory foods like gluten, dairy, sugar, soy, alcohol. All of those things do not play well with us and our hormones, specifically towards menstruation. Like we get those cravings. It's like, oh, I want that crap food. And the reason is because estrogen is dropping, and estrogen helps balance insulin. Insulin is, controls our blood sugar. So if we don't have the estrogen to balance insulin, that's where we want that crappy food. But we don't really want it. It's our hormones telling us that we want it. So if we understand that and say, hey, I'm not going to pick the cookie. I'm maybe going to grab a handful of berries that's like low glycemic, not causing the inflammation. Our PMS is going to be a lot less. And then third is environment. We have so many endocrine disruptors in our environment, and our endocrine system is our entire hormone system. So the thyroid, the adrenals, and our reproductive hormones. So recognizing the things that we're exposed to. So Wi-Fi, EMFs, pesticides, toxins, things like that we're exposed to on a daily basis, and being aware of what we can control, because there's a lot that we can't. We can't control the Wi-Fi and the EMFs where we are sometimes, but we can control what we put on our bodies, what we put in our bodies. And that's just becoming aware of reading labels, looking up ingredients, using apps to help you with that. Like my favorite app is the Yuka app, YUKA. You can scan things and it'll tell you if it's good for you. And a lot of things that are poor, the number one ingredient is an endocrine disruptor. So trying to reduce our toxic load, making sure we're sweating, pooping, peeing, you're getting the exercise on a daily basis. It doesn't have to be intense. Walking is probably the best thing anyone could do for themselves. If they don't feel like doing anything, go out and walk. You're still moving the body. You're moving your lymph. You're getting things, processed, getting that sun. The sun, vitamin D is more of a pre-hormone than it is a vitamin, because we need the vitamin D to actually make our hormone. And it's so helpful for your mood and your immune system. So prioritizing exercise. And then I would say the fifth one would be sleep. So never compromise your sleep. Your body does all of its repair overnight. or your digestive system, your immune system, your cholesterol, like everything is resetting overnight. So never skip on sleep.
And so even if you have a night where you don't sleep very well, you're basically saying like your body wasn't able to fully reset. That's why sleep is so important.
Yep. And that's
That
why
actually made a lot more sense to me now.
And that's why you shouldn't, that's why they always say, like, don't eat a heavy meal right before bed, why you shouldn't really have alcohol before bed, things like that. Because if you drink, right, some people use it as a medication to sleep, but you're not getting good sleep because now your liver is working in overdrive to try and process and break down all of that alcohol. Plus, it's trying to do everything else it's supposed to do overnight, and it can't.
So actually, I have more friends that say if when they drink now before bed, it actually wakes them up in the middle of the night. So what's happening there?
So it's the liver. So if you're waking up, I think it's between 1 and 3. 1 and 3 a.m., it might be 2 to 4. Anyways.
Regardless, it sounds terrible.
Right? If you're constantly waking up around those hours every single night, that's your liver. That's Chinese medicine right there for you. So if you're drinking and you pass out from booze, and you wake up, then yeah, that's your liver telling you like, hey, I'm mad at you right now.
Yeah.
So yeah, you don't really get good sleep when you drink alcohol, even though you think you're sleeping. You're not.
How about marijuana?
So there's a lot of benefits for marijuana. I just read a study though about it.
Sorry, I just said marijuana like I was a little kid saying a bad word. Sorry.
Pot.
It's okay, Tori. You can say marijuana. Okay, sorry. What about marijuana?
There's a lot of benefits to it. I personally like CBD without the THC. CBD has almost the same, if not more, benefits than marijuana without the psychoactive component. So, because a lot of people can't do marijuana for their job or they get tested or whatever. Athletes, drug testing. I'm pretty sure that's not allowed, but CBD should be. And there's no THC in it. It has almost the same benefits because it still works on our cannabinoids, which is what THC does. So yeah, CBD is wonderful. I use it a lot for patients to help calm their, brain, even pain, cramps. Like it's really good for hormonal cramps.
All right. Well, then let's wrap up this discussion. It's been so I feel like I'm forgetting to ask questions because I'm just so enthralled with what you're talking about. Can we narrow it down to maybe 3 tips to have peak performance based on your hormones out there on the golf course? Because even what you've been telling me today, I'm going through my menstrual cycle right now, and I totally did wake up today and I'm just walking around like a zombie. I don't have a lot of drive. It's making me feel bad. Because I want to be come on, let's get to it. The day is starting. Let's go. And it's wait, maybe it's just your body's time. You're not able to have that full hype.
Exactly.
That sometimes
and that's
we
okay.
want. Yeah.
That's okay. And you should honor that.
And it's so hard to say it's okay though.
It is, but as you mentioned, you like excuses. Oh, so be like, I'm
on the golf course. We do.
See,
we do.
So if you do play golf today, you can be like, well, you're gonna win because I'm on my period and I'm not on my A game. No, my first tip would be to become aware. So if you're not tracking, start tracking. You should track for the pure purpose of knowing for your own benefit. A lot of women track because they don't track because they're like, well, I'm not trying to make a baby. It doesn't matter. Track because you need to use your hormones to work for you. So if you understand where you are in your cycle, you're going to know that. But you don't know where you are in your cycle unless you start bleeding, unless you track. And you could just simply, there's tons of tracking apps. There's the Flow, there's the Clue, there's Natural Cycles. Natural Cycles is my favorite. You can track on your health app, on your Apple phone. If you have an Oura Ring, you can track on there. There's so many ways to track, or just use pen and paper on a calendar if you use a paper planner. And that way you can be like, ooh, ovulation is coming up. I'm going to plan to do this, or I'm going to have my talk then, or I'm going to go on a podcast then, or whatever the case, or I'm going to try and beat this person I can't beat at golf on that day because that's where, my hormones are going to help me. So my number one tip would be to track. Secondly, if you feel all over the place and you don't even know where to begin with tracking, or maybe your cycle's just so irregular, or you've had an ablation, maybe you have an IUD, or you've had a partial hysterectomy and you don't bleed, let's get your hormones tested to see how optimal they are. And then we can balance. You can still, you should still get your hormones tested if you are bleeding, just to make sure that things are balanced so that you can, have the optimal performance with that. And then 3, I would prioritize all of those things we just talked about with, diet, stress, environmental, things. Start looking at that, becoming aware of it. It's mind-blowing when you actually start paying attention to that and like looking at the products you use on a daily basis, like your shampoo and your lotion, and all of that gets absorbed through our skin and it can have an impact on our hormones, but you don't know if it's clean. And don't trust labels. Like when I say don't trust labels, like looking at them when they say it's clean, a lot of things are misled, and you really need to know the ingredients that are in there that could be impacting your hormones.
Yeah, that's fantastic. All right, so this is my last question for you. I think you never know. Maybe I'll have another one. But what was the last thing you were really excited about in your industry? Like, is there something that you have felt like, oh my God, this is going to change everything?
Oh gosh, in my industry,
even maybe in the health and wellness as a whole. Did you where something came up, or there's a new trend out there that's going on that you're like, this can change everything. This is really important.
It's funny you ask that, because I think our industry has felt really defeated lately.
Why do you say that?
Because the FDA they're taking away some peptides that are very helpful for, I don't do peptides per se in my office, but I know a lot of my colleagues do. They're cracking down on IV therapy. It's just, we feel defeated right now. So it's interesting you say, like, what do you feel excited about? Because I haven't felt excited lately, because they just keep trying to take away everything that is good for people and making it hard.
What is the purpose of them? Because...
We'll save that for another conversation.
Okay.
I would say what I get excited about, and I wouldn't say anything recently, is when I give women some answers that they've not had.
Yeah.
Or they've felt defeated, or they say that they don't feel good and they've just been dismissed. Or they're just like, oh, it's just menopause. That's the way it is.
Yeah.
And they just feel like they have to suffer. And then they come see me and I'm like, you don't have to suffer. Or they've had some lab work done if they've been told they've been normal. And I see their labs. I'm like, nothing about this is normal. I'm not entirely sure why you were told that. Like, we can do this, we can do this, we can do this. And their eyes just like light up like, oh my gosh, I'm not crazy. There's actually hope for me.
Yeah. I'm not so emotional. I'm not so crazy. All those things.
Yes. I mean, I've seen marriages like on the rocks. I talked to a woman this week and I was like, well, how's your libido? And she just laughed. She goes, my poor husband. And you don't have to suffer. Like, women do not have to suffer. But I feel like nowadays we're told we have to. And we don't. Yeah. So going back to what you said earlier, or the question you asked me, and I said, if you don't feel yourself, that's your first clue that something's going on. And don't stop at everything's normal. I would be rich if I got paid for every time I was told someone's labs were normal. Because I've never seen a normal lab.
And that's for all ages too?
All ages.
Okay.
Yep. Men, women, all ages.
How do you determine a baseline then? I mean, you just kind of, what your best days feel like, and then you just go off of that?
Yep. And a lot of times, I think a baseline is hard nowadays, because so many women have felt so crappy for so long that that's their baseline. They don't even know what it's like to feel good. And I see that often.
And again, it could just be a hormonal imbalance when they're possibly even going to get like antidepressants or anti-anxiety medications. And you're saying that might not even be needed or necessary.
I just saw it this week. I said, you are so deficient in B vitamins and vitamin D, and she's on 2 antidepressants. I'm like, and her thyroid was not managed well. So we're fixing that and these vitamins and a couple other things. And I'm like, I would say in maybe 3-4 months, we can have a discussion on trying to pull you off these antidepressants, because there's a huge correlation between vitamin deficiency, ADHD, depression, and anxiety. Huge. And your thyroid. But conventional medicine doesn't look into those things. They're just like, oh, you have this? Here, take this pill.
Yeah.
But naturopathically, we look at the body as a whole. We try to get to the root of it and give your body what it needs so it can heal.
How about things like cold plunges, infrared therapy, sauna, steam room therapy? What are all those just really good instruments to help get the body going?
Absolutely. I'm a huge fan. I was a part of a sauna studio that had the infrared sauna with a red light in it, and I would go so much that I got my own. So I have my own sauna, and then I've wanted to do cold plunge for so long, so we recently got a cold plunge, and love all three of those things. Huge factors in recovery as far as like training. Obviously, you don't want to train and then jump in the cold plunge. That can actually negate some muscle growth because it cuts off the circulation or blood flow to your muscle.
And that's almost when I want to do it. So you're saying do it first thing?
Yeah, before you exercise or 4 hours after.
Okay,
because the cold is constricting. So if you constrict, you're not allowing the blood flow and the circulation to go to the muscles to grow it. It's called muscle atrophy. They're going to like start to dissolve if you do the plunge right after. So if I do strength training or weights or anything like that, I usually wait 4 to 6 hours after to plunge. Or I love to do it first thing in the morning. It opens, wakes me up, gets things going. You always typically want to end on cold. So if you have hot, cold. You can even do that in a shower. Now, in Arizona, we may actually get cold water in our faucets, whereas during the summer, you don't get cold water, so you can't do it.
Totally. Arizona problems right there.
Right? But now you can do hot, cold. Hydrotherapy has been around for years, and it's such a helpful modality. I mean, people are like, what's the benefits? I'm like, what is there not a benefit for? It can benefit, your cells, your mitochondria, your brain. I mean, there's studies that it can help hormones. Cold plunge can increase testosterone, prevent Alzheimer's. Like there's just so many benefits to it. It's like, why wouldn't you add that into your routine?
And how about infrared therapy?
Love it.
What is it exactly?
So infrared, so there's dry saunas, there's infrared saunas, there's steam saunas. I think they all have their benefits. Like a lot of the gyms have dry saunas and steam rooms. I love infrared because it heats your body from the inside out. So you typically don't go in there and sweat right away, whereas you would in a dry or steam. So it's heating you from the inside out. So it really activates your immune system. It's kind of like a pseudo fever. So it raises your core temperature. Like my Oura Ring picks up on it all the time. It's like, oh, your heart rate got higher. And it's like, yeah, because you're kind of like creating a fake fever to stimulate your immune system. So you don't sweat right away. You sweat maybe 10 to 15 minutes into it because it's heating you from the inside out. But again, you're sweating, you're detoxing. It's amazing for your skin, your immune system, like sleep. I mean, you can go on and on and on with the benefits.
Thank you so much.
You are so welcome.
I really took away, again, this is a reminder to me because sometimes I track, but I'm a little inconsistent with it. So I'm going to get back to tracking the cycle and then also be a little more gentle and patient with myself during that menstrual cycle because like production makes me feel worthy.
Yep.
What's that? That's a whole nother therapy appointment. But so if I'm not having like a high production day, I feel bad.
Yep.
And it's like, no, it's okay.
Yeah.
You're okay.
Yep.
So,
and if anyone needs help with a plan, I have a planner. It's a period productivity planner. So you can find it on my website. It's a physical planner.
Give us the details on that.
Yeah. So it's a physical planner. So if you are old school like me and you like to write things out
Which a lot of us do. I know listeners like a hard copy still.
So I made it to be a planner and like planner for your daily stuff. And then also so you can put in there where you are in your cycle so you can plan it. So it's a period productivity planner. You can find it on drerinellis.com on the top right corner or on Amazon. Just search for it.
Perfect. And I'll put that in the show notes too. Thank you so much for being here, Dr.
Thank you,
Ellis.
Tori. It's been so fun. Hormones are my jam.
So fun. So now anytime you think of women's golf, you'll think of us and maybe get out on the course one day.
I mean, I probably should take it up again. But I would love if any of the listeners implement this and then they notice some trends in their performance on the course, like send me a DM. I would love to hear how it's helped you.
Absolutely. I'd be interested too. Yes, for sure. So thank you for being on.
You're welcome. Thank you.
We'll touch base soon.
Okay.